Hello, my name is Eric Tizon, and thank you for taking some time out of your day to go over my presentation with me, even though it's part of your grade, but it's neither here nor there. I just want to show a list of some of the bacterial infections that people have chosen from the course to do their projects on, and there's a lot that people deserve, think deserve a lot of funding, and I don't want to take away from any of these, but the one I chose was Mycobacterium tuberculosis, specifically just like what the cause of TB is, also known as tuberculosis. So let's get into it. So what is tuberculosis? Well, first of all, we're in killer microbes. So it's a bacterial disease, and it's actually one of the oldest diseases. It was discovered in 1882 by Dr. Robert Koch, and that's him on the right side, if you could not tell. And that photo is probably from around 1882. Looks pretty old. And it can affect different areas of your body, such as your bones, your central nervous system, but in many cases, it affects people's lungs. And it has approximately a yearly mortality of 1.25 million globally, and about 500 to 600 of those deaths are in the United States. So, what is Mycobacterium tuberculosis specifically? Well, the bacteria is a slow growing bacteria in relation to others that may divide in a couple of hours. Mycobacteriums take about 18 to 24 hours to divide, and specifically for tuberculosis, it has a lot of mechanisms that allow it to survive and transmit itself from host to host. For example, it can hide in macrophages. We learned that about that in the throughout the course. Some bacteria can bury themselves in macrophages and cut themselves off from the rest of the body so that the macrophage doesn't know where they are. And with many other bacterias, it's becoming increasingly antibiotic resistant. So when people take a round of antibiotics to treat their disease, maybe one or two, 300 people say like, "Oh wow, I feel better," and then they stop taking their antibiotics, and that's when the remaining tuberculosis cells in your body like, wow, okay, we survived the drug, now we can adapt to it, and now when we infect the next person and they're prescribed the same thing, they're not going to be able to overcome us, and then we're going to kill them. So they're becoming increasingly antibiotic resistant, and also they have thick waxy cell walls, which oh, okay, other cells have cell walls. What makes these ones so special? Well, it allows them, let's say if I were to cough into the air and then I'm by a door, well, it could live on surfaces for an extended period of time without dying and will be resistant to low level disinfectants because of this thick waxy cell wall. And it can also hide in hosts without causing a disease, so that, oh, you don't expect anything, and then boom, one day it was like, oh wow, how come I had TB in me, but you've had TB in you all along, but now it's become active. So, what are the symptoms and how can it spread? Well, coughing, chest pains, and like coughing up blood and fever are some of the symptoms that you get from the disease, because mainly when it affects your lungs, it makes it harder to breathe and restricts your airways. So, you're going to be coughing a lot. And how is it transmitted? Well, it's transmitted through the air from hosts to others, whether it's sneezing, speaking, singing, or coughing. And as you can see on the photo on the left side, you can see this Pokemon is coincidentally called Coughing, and you can see all these smokes of cloud. I want you to imagine those are tuberculosis cells. Just you're coughing into the air and you're not covering your mouth with your elbow or sneezing into your shirt or something, and then all these bacteria are just going out into the air so that when grandma walks by and you're coughing, and then boom, now grandma has tuberculosis. So it's a pretty serious thing. And TB can also restrict and damage your lung tissue, making it harder for you to breathe. And when I say it's harder to breathe, it means it's easier to spread. Is you're trying to get air into your lungs, so you're trying to clear your throat, you're coughing a lot, and that's putting a lot of the TB cells out and about. So, what are some treatment options before and after the infection? Well, there used to be the vaccine's still used, but it's called the BCG vaccine, and it was for children about 10 to 14 years in age. But the United States actually stopped administering these vaccinations for the children in about 2005, because the rates of tuberculosis in the United States are basically non-existent. So it's not really mandated anymore. And then once they're identified, so let's say your grandma, you walked by and you're feeling kind of sick and you have the infection. Well, how do you go about treating it? Well, you can get a round of antibiotics, and as long as you take the full round, you should be cured of the bacteria. Here are some of the antibiotics that are prescribed for specifically tuberculosis. And the treatment window for taking these pills is approximately going to be about 6 to 9 months, but you'll start feeling a little bit better after a few weeks of taking the antibiotics. And like all drugs, there's going to be side effects. So it's not common in everybody, but some people can get skin rashes or yellowing of the skin or eyes, also known as jaundice. You could also have a darker urine color. So, okay, Eric, you're wondering, oh, why did you explain to me what TB is? What is the reason for, why it should get more money in research and funding? Well, one of the big issues with TB is it's not super prevalent in the United States because, well, as you saw by the previous slides, that we don't administer the vaccination anymore because it's not that much of a threat. But in other areas of the world, they're suffering because their programs don't have enough funding to either research research the drugs, research the advancement of the bacteria, and they can't provide adequate screenings. So in areas that are heavily affected, like Southeast Asia and Africa, to say, their programs are significantly lacking in resources to provide care, and approximately 7% of the deaths in these areas can be chalked up to tuberculosis, which is completely preventable and curable. But because of the lack of research funding and overall funding for their programs, people are dying these deaths that can be easily prevented. And like I said, the high cost of treatment and the long-term tests make it harder for less developed areas to catch and treat tuberculosis. For example, there's a long antibiotic course that I previously mentioned that is 6 to 9 months. Drugs aren't free, unfortunately, and we know that prices for these drugs are only getting more expensive as healthcare companies and pharmaceutical companies are patenting them and moving on. There's also lengthy tests for TB. There's a skin test, which is doctors will inject a certain chemical into your skin, and you have to wait approximately 3 days. And then when it turns a specific shade of color underneath your skin, then they can diagnose you with whether you have tuberculosis or not. Or you can have straight up blood tests, which will be sent off to labs. But if you're in the middle of Africa and you need a tuberculosis test, then you're out of luck because there's most likely not a laboratory nearby. And also, additionally, the need to increase global health security. We saw it recently with the coronavirus and how everybody was hit very hard in every single area, rich or poor. So just because one place is scot-free or not dealing with a certain virus or infection more regularly than other areas, that doesn't mean that the less privileged areas deserve to not be free of that virus. And like we learned throughout the course, protecting as many people as you can help protect others that can't get themselves vaccinated or afford these drugs. So allowing TB research and programs to receive more funding can protect more people around the world, and then that can help protect others that aren't as fortunate to get treatment and preventative measures for it. So that would just make the whole world a lot safer, and I think everybody wants to live in a world where we can all feel safe. Thank you.